scrotum right here. That's what this represents. Of course, the testes are here. This streaked thing you see here, this would be the cremaster muscle right here. This over here, I'll get that off of there. Here's testis right here. Here's epididymis right here. Now this is turned sideways, just to show you this. Normally, that epididymis is directly behind or posterior to the testis here. All right. What's under my finger here is spermatic cord. All right. Here's a spermatic cord opened up somewhat, so you can see some of the structures that are in there. So you've got the blood vessels, you've got nerves, you've got lymphatic vessels in there, you've got the vas deferens in there. Vas deferens begins at the tail of the epididymis and comes on up. So here's the external ring or opening of the inguinal canal. What's under my two fingers would be the inguinal canal. And here's the internal opening right here, just medial to the femoral vessels. In fact, you can see the vas deferens entering through the internal ring right here, just medial to the femoral vessels right there. Okay, so here's penis right here. Now, this pink part here is what I was telling you was the glans penis. And in this particular model, this is a circumcised state because that hood or foreskin or prepuce has been removed. All right, so here is urinary bladder. And if you turn this around like this, you can see here's ureter, here's the other ureter. Here is vas deferens coming this way, posterior to the bladder. Here's its expanded end, right here, like this. And here's the seminal vesicle over here, lateral to it. Okay, this sort of reddish structure right here under my two fingers is the prostate gland, or just prostate. Okay, here's rectum behind. All right, now if we take this apart and take this much out, here's prostate right here. Now this little channel right here going through the prostate, just part of it, this is ejaculatory duct. So you don't see the whole ejaculatory duct, the rest of it is deep there, but that's ejaculatory duct. This part of the tube here is the prostatic urethra, right here. Okay, so down here, here is our prostate, right here. Here's the prostatic urethra, here's the bulbous urethra, and the penile urethra. This is all erectile tissue that you see in here, in the blue. This is all that erectile tissue. I'm looking for the bulbourethral gland. Here it is, right here. It's right down next to the pelvic floor. It's this little thing right here. And of course it's bilateral. This is the closest I can come to it, right there. All right, now, if we bring this back together and take this off like this, and put this together, you can see the erectile tissue in there now. These two bodies at the top are corpora cavernosa. This one right down here is corpus spongiosum. And the urethra is right there. Right there. Penile urethra. Okay, this is the female right here, so this is anterior, this is posterior. And so here is urinary bladder right here. Here's uterus. Okay, here's rectum. All right, here are the ovaries. Here are the uterine tubes in pink. Let me turn around this way. The uterine ovaries, uterine tubes in pink. Those sort of beige structures right there are the ovarian ligaments. the ovarian ligaments, securing the ovary to the uterus. These blue things right here are round ligaments. Round ligaments in a female are the analog of the vas deferens in the male. So these are for support only in the female. They attach to the uterus here, they come out and head into the groin, right where the inguinal canals would be, and they end blindly there. They're just for support. Now, the broad ligament is going to be under my fingers here and over the front and back of the uterus. Okay, so this is all broad ligament. The part of the broad ligament that supports the tube is the mesosalpinx. The part that supports the ovary is the mesovarium. But it's all, the overall umbrella term is broad ligament. So if we take this apart, put that down there. And if we look at this from the side like this, so here is labium majus, labium minus, here. Here is urinary bladder, here's urethra, here's the external urethral orifice right there. All right, here is the vagina. So this is the vaginal orifice down here. Here is the vaginal canal, and these little recesses up here are the fornix, vaginal fornix. Okay, this is all uterus right here. So it's tilted forward, anteverted, normal position. So this lower part of the uterus here is the cervix. This is the body, and the fundus is the curved part at the very top. So the cervix has an external os that I'm pointing to. It has a cervical canal, and it has an internal os that I'm pointing to right there. This is the uterine cavity proper.
What did you say an os was?
Os is a word for opening.
Okay.
OS, os. Now on this model here, if you look close, you can see a light pink line with a little bit darker red zone just below it. That represents the endometrium of the uterus. What's under my fingers, I move it back and forth here, is myometrium, the muscle of the uterus. Of course, this is rectum back here. This would be a greater vestibular gland right here, or Bartholin's gland. All right? So you can look at that. These would be similar here. You've got the keys here to look at, but what you would be seeing here would be similar to what I showed you on these models right here. So if there's any question, you can ask me and I'll clarify it for you.
So in the female, we have two round ligaments.
Mm-hmm.
Okay, one at the living, one.
Yeah. Right and left. Mm-hmm. There's some other models on the back there that I don't think are as good as these, but when you look at those, you could be able to translate from what you're seeing here to what's on those models back there.